we started doing this work and when no one cared about it, now there's too much work to be done and everyone cares about it. It's fascinating. And
what do you attribute that to, by the way? How much of that do you think is an indirect or even a direct consequence of the attention that's been brought to brain injury through the light of CTE vis-a-vis the NFL?
Yeah, it's an interesting question. I mean, clearly the spotlight on this injury is iridescent, and clearly the NFL is a very powerful enterprise and there's a lot of eyes on it and there's a lot of discussion, open discussion on this topic, which is a good thing in a lot of ways. It drives science and it drives awareness, but too much awareness without a solution is called hysteria. And we see that happen with this injury. When the reality is that there's a lot of misinformation out there about concussion, and I think it actually hurts outcomes a lot of times. Clinicians that aren't aware of the recent advances in knowing how to treat this, clinicians that don't know how to do the right evaluation. And there's a lot of mismanagement and mistreatment of this injury that leads to very poor outcomes. Again, and you're going to hear it from me over and over again, if you bring me a patient with concussion, I can pretty much tell you I can treat that and get that patient better and get them back to the sports they love. There are highly effective treatments with this injury.
Is this the sort of thing where there's a relatively finite window in which you or the physician treating has to be able to access the patient, and the further a patient is from that window, absent the natural history resolution, the more difficult that gets?
Okay, so I'll answer that with data. We just did a study, again, published in, I think it was in JAMA Neurology as well, where we looked at what factors best predict outcomes from concussion. Migraine is a huge factor predicting outcome, history of migraine. There's certain symptoms that predict outcomes. But we looked at all those things. The one factor that best predicted outcome was how quickly they get into our clinic. If they were seen by us within 7 days, that was the best predictor of someone who got better from their injury, because we can apply our treatments quickly. And if you do wait, it's harder to treat. But I still will argue, even if you're a year out, 2 years out, 3 years out from this injury, we can treat it effectively the great majority of the time. It's not irreversible. You can get patients better even if they've been living with it chronically. Peter, today, I saw patients all morning. I had 20 patients on my schedule before our podcast. I just saw a race car driver from Phoenix or someplace, and they've been going through this for 2 years and miserable. We will get that patient better. They will be normal when we finish treating them. There's nothing I'm seeing that worries me about them.